Tuberculosis (TB) for World TB Day, March 24, 2025. I am going to talk on epidemiology, challenges, advancement, and strategy for TB elimination. World TB Day 2025. Yes, we can end TB. Historical significance. TB has plagued humanity for centuries. Hippocrates, father of medicine, described it as a phthisis in ancient times. Robert Koch discovered the TB bacterium, Mycobacterium tuberculosis on March 24, 1882, leading to the development of diagnostic techniques. World TB Day was established to raise awareness and reinforce efforts to combat tuberculosis. So the current global burden, TB remains one of the top 10 causes of death worldwide. WHO report 10.6 million new cases and 1.3 million deaths annually. TB is preventable and curable, yet it is continues to devastate communities, especially in low income countries. So, understanding tuberculosis. First is what is tuberculosis? A contagious bacterial infection primarily affecting the lungs, that is a pulmonary tuberculosis, but can also involve other organs like bones, brain, kidney, lymph node, and called as a extrapulmonary. So, next stage is transmission and risk factor. It's a airborne disease spread by droplet nuclei when an infected person coughs or sneezes. So, who are at the high risk or the which is a high risk group? People with HIV and AIDS. TB is a leading killer of HIV positive individuals. Diabetes patients, smokers, malnourished, alcohol abuse, and in the last, healthcare workers who are working in tuberculosis in TB endemic region. Socio-economic factors are overcrowding, poverty, poor ventilation, increased transmission. So, what are the symptoms and how it is diagnosed? Was the symptoms of pulmonary tuberculosis. There is a persistent cough for more than 2 weeks, fever, night sweat, and weight loss. These are the symptoms which are seen in the pulmonary tuberculosis. Chest pain, hemoptysis, blood in sputum also seen. So in extrapulmonary tuberculosis, if it is a TB meningitis, it can causes headache, confusion. If bone TB, the joint pain, spinal deformity. In abdominal tuberculosis, there will be pain in abdomen, weight loss, ascites. So what are the diagnostic advances? The traditional methods are sputum microscopy, which is more than 100 years, still used but has lower sensitivity. tuberculin skin test, that is a Mantoux test, TST, detect latent TB infection. Modern rapid methods or test, gene expert, that is a CBNAT, cartridge based nucleic acid amplification test. It detects TB within hours and identify drug resistance. TrueNet, that can be taken to the point of care test for faster detection in rural area. Culture and DST. Culture method is a gold standard. Then comes the whole genome sequencing, emerging as a powerful tool for tracking resistant patterns. So now let's talk about the drug resistant tuberculosis. A major threat, multi drug resistant TB, that is MDR, resistant to first line drugs, that is isoniazid and rifampicin, that is HR, requires longer, more toxic and expensive treatment because the drugs are more costly. Extensive drug resistant tuberculosis, that is XDR-TB. This resistant to fluoroquinolone like levoflox and moxifloxacin, and initially it was second line injectable, but now bedaquiline and linezolid has been taken into this pattern. Limited treatment option, mortality is high. The new drugs and regimes, bedaquiline, delanamide, protonamide, new drugs offer a shorter, safer treatment. WHO BPAL regime, in which bedaquiline, protonamide, linezolid, they are given for a 6 month. This regime showing high cure rate for XDR TB patients. Now let's talk about the TB prevention and control strategy. First is a vaccination, BCG vaccination, given at birth in TB endemic countries. It provides partial protection, especially against severe form of tuberculosis in children. New vaccines are in clinical trial with promising results. Now, preventive therapy. Latent TB treatment for high-risk individuals, INH preventive therapy, IPT. It reduces active TB risk. New short course regime, that is a 3HP. It contains rifampicin plus isoniazid for better adherence. Now let's talk about the infection control in healthcare setting. Early case detection and rapid treatment to break transmission. Ventilation, ultraviolet air, that is UV light, disinfectant, mask, N95 respirator in a hospital. So about community-based intervention or prevention. Strengthening dots, strengthening dots directly observe treatment short course, active case finding in high burden area, engaging NGOs, social worker and community health volunteers. India's national TB elimination program NTEP and global targets. India's initiative Nikshay Poshan Yojana, that is a nutritional support for TB patients, universal drug susceptibility testing, that is a UDST, ensuring early detection of resistant. Private sector. Private sector engagement, free TB diagnosis and treatment across all the sectors. TB Mukt Bharat. There is a TB Mukt Bharat campaign targeting TB elimination by 2025, 5 years ahead of WHO global goal. Global target WHO and TB strategy. 90% reduction in TB death by 2035. 80% reduction in new TB cases and zero catastrophic cost for TB affected families. Call of action or call to action, yes, we can end TB. We must work together, doctors, researchers, policymakers, and the communities to TB, to defeat the TB. Early diagnosis, complete treatment adherence, and breaking stigma are key to TB control. Investing in research, better vaccine, and affordable treatment is crucial. If we act now, a TB free world is possible in our lifetime. Yes, we can end TB. Thank you.